You hit 50, and suddenly your body starts whispering things it never said before. Low energy, trouble sleeping, frequent nighttime bathroom trips, mood swings, and wait, where did that muscle go? It's not your imagination. These are not just signs of aging. These are red flags your body is raising, and today, we're diving into what every man over 50 needs to know to take back control of his health. In the end, we will provide a 50-plus health checklist. So stick with us for just 5 minutes if you truly care about your health. Let's start with testosterone and your prostate. We all know that testosterone is the hormone that fuels a man's vitality, muscle mass, sex drive, and even mood and confidence. But after 30, testosterone drops about 1% every year. By 50, many men experience what's known as andropause, often called male menopause. Common symptoms of low testosterone include fatigue, even after 8 hours of sleep, decreased libido or erectile issues, loss of muscle, gain in belly fat, irritability, anxiety, or even mild depression. Fact check. A study published in the Journal of Clinical Endocrinology and Metabolism found that around 39% of men over 45 have low testosterone levels. The problem? Most don't even know it. What you can do. Get a testosterone blood test if you notice symptoms. Incorporate strength training and high-protein diets. Get adequate sleep. Testosterone peaks during deep sleep. Avoid chronic stress because cortisol kills testosterone. Consider testosterone replacement therapy, TRT, but always under medical supervision. Now it's time to discuss the second most significant issue, enlarged prostate. If you're waking up multiple times at night to pee or feeling like your bladder never fully empties, you might be dealing with benign prostatic hyperplasia or BPH. It's not cancer, but it's still serious. By age 60, over 50% of men will have an enlarged prostate. By age 80, it climbs to 90%. What is it? The prostate, a small gland that helps produce semen, starts growing and pressing against the urethra. That's what causes the urinary symptoms. Symptoms to watch for: weak or interrupted urine flow, frequent urge to urinate, especially at night, difficulty starting or stopping, feeling like your bladder isn't empty. What you can do: reduce caffeine and alcohol. They irritate the bladder. Avoid decongestants. They tighten prostate muscles. Ask your doctor about alpha blockers or 5-alpha reductase inhibitors. In severe cases, minimally invasive surgeries are available. Fact check. Unlike prostate cancer, BPH doesn't kill, but it can seriously reduce your quality of life. Get your PSA levels checked regularly. Now let's discuss heart disease, the #1 killer. Here's a hard truth. Heart disease remains the #1 cause of death for men over 50. The scary part? You often don't feel anything until it's too late. Why men over 50 are at risk? Because arteries naturally stiffen with age. Testosterone decline can worsen fat distribution. Years of poor diet, lack of exercise, or smoking catch up. You should never ignore chest pain or pressure, shortness of breath, dizziness or sudden fatigue, erectile dysfunction. It can be an early sign of heart issues. Protect your heart. Eat heart healthy. Think Mediterranean diet. Fish, nuts, olive oil. Exercise regularly, 30 minutes of brisk walking 5 days a week. Manage blood pressure and cholesterol levels. Ditch the cigarettes and control stress. According to the CDC, 1 in 4 men will die from heart disease. But 80% of heart disease is preventable with lifestyle changes. Now, let's discuss some other major concerns men face after 50. Number 1, type 2 diabetes. After 50, insulin sensitivity decreases. Many men are pre-diabetic and don't know it. Get your A1C levels tested. Stay active and reduce sugar intake. Osteoporosis. Yes, men can get it too. Low testosterone and low vitamin D are major causes. Eat calcium-rich foods, get sun exposure, and lift weights. Depression and isolation. Men over 50 may struggle emotionally due to retirement, loneliness, or chronic illness, but tend to not talk about it. Check in on your mental health. Therapy isn't weakness, it's wisdom. So what's the roadmap to healthy aging? Your 50-plus health checklist. Annual physical exam, testosterone and PSA levels, heart screening, blood sugar test, colonoscopy, weight-bearing and cardio exercise, cut alcohol and quit smoking, supplement vitamin D and omega-3s. Think of this decade as your launchpad, not a decline. What you do now determines how sharp, strong, and energized you feel in your 60s, 70s, and beyond. Your 50s can be your power years, but only if you make your health a priority. If this video helped you, give it a thumbs up, share it with the men in your life, and don't forget to subscribe for more science-backed health insights. Thanks for watching.